This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor. Welcome to
Healthcare Snitches. Hey guys, welcome to Healthcare Snitches.
Hello. All right. What episode is this?
Something. I don't know. It's been a long time.
All right. So this is episode probably 18, 19? Who knows?
Is it?
Whatever. Something like that. Before we jump in, though, I want to remind you guys to like and subscribe to our YouTube channel, Healthcare Snitches. Also, follow us on TikTok, Facebook, Instagram, Black Planet, MySpace, all those places. LinkedIn.
LinkedIn too?
Where else?
Blackpeoplemeet.com.
FarmersOnly.com.
Who?
I don't know. Match.com.
Sugardaddy.com.
Yes.
Some of my family know about that.
But seriously, follow us on all the first ones we said, not the dating sites, because we're not on there.
Yeah, make sure that you like and share and subscribe. Don't be like some people and just subscribe and not watch it.
Yeah, make sure you watch it and tell your friends and tell your neighbor, tell your uncles,
tell your cousins, tell the people that sell Heinekens at the bodega,
tell your baby daddy,
tell your dog walkers, tell a pilot when you get on the plane,
tell your mother,
tell the nurse who's in the office with you when you go into the gynecologist to go get a pap smear,
tell your dentist, tell your ophthalmologist.
See, and you should have all these doctors and stuff if you listen to us. All right, so today's topic is going to be alcohol abuse. Now, I know a lot of people out here drink alcohol. Me personally, I don't drink alcohol. I have a natural high. I don't have to drink alcohol. You know, growing up, I would watch my mom have one Heineken, and then the basin or the garbage would be next to her, and she would be vomiting from one drink. And everybody know that I have a fear of vomit, so it traumatized me. So that's the only reason why I don't drink. I know you don't automatically vomit from drinking, but I just relate alcohol and vomiting, and I just will never do it. So,
well, I can't say the same.
Have you ever thrown up from vomiting? I mean, thrown up from vomiting. Thrown up from drinking?
Yeah. Mm-hmm.
You have? Mm-hmm. And that didn't say...
No, I just don't drink that anymore. Like,
oh, so you blamed it on that, not on alcohol.
You have to have a strategy when you're drinking. But I'm not.
I don't want to mess around and find out though.
Okay.
I don't want to do trial and error.
Yeah, you can't be drinking on empty stomachs. You can't be mixing browns and whites. You got to do it right.
So, what made you vomit?
This was actually, I blame my brother because no, I'm not gonna say that. I blame him, but it was a mixture of like mixing brown liquor with white liquor and like all these sweet things in between, and there was like chicken wings involved. Well, it wasn't good.
Wasn't the chicken wings a good thing though to absorb?
No, because it was greasy, so it didn't help.
Excuse me.
I'm sorry. I should be saying clear liquor. My bad. Our fake producer is correcting me.
I think that started all over.
No.
White.
Okay, clear.
It's clear and dark.
All right. Well, we ain't restarting. You just gonna be in the episode. So, yeah, mixing the clears and the darks, and then the chicken wings, and a lot of it.
So, what do you stay away from now? Because the damn sure ain't chicken wings.
It's not. You're right about that. That night it was amaretto, so I don't do that anymore. Actually, I haven't drank it since that time.
Amaretto isn't creamy?
No.
Oh, see? I have no idea. I do not drink.
Okay. Yeah, I don't do that no more.
So that's the only alcohol that you stay away from?
I also don't really like gin. I just don't like it.
But aren't there so many mixed drinks out here that have gin in it?
Yeah, I mean, if it's mixed with other ones, then it's fine. But I'm not gonna go up to the bar and be like, "Let me get a shot of gin." Like,
Okay.
no, thank you.
Well, excuse me. Sorry. In my 20s, me and my cousins and my friends would always go clubbing, and everybody be getting drinks, and I'd be like, "Let me get a Shirley Temple." It was so crazy because they would have like these cute little drink cups, and I would have this big plastic cup with a Shirley Temple in there. But
a sippy cup.
it was big though. Like you could always tell that it was like soda or something.
Did everyone always used to try to make you like the designated driver?
They didn't have to make me. I was automatically the designated driver. Because you wasn't letting them. Well, my cousin Sabrina actually drives better when she's intoxicated.
Oh, okay.
So when I didn't drive, she drove. And we all rode just fine. She's actually a really good intoxicated driver. God, please forgive me for saying that. I know I sound foolish. But yeah,
I'm actually pretty good too. Like I'm a little bit more aware.
I've never been in a car with you when you were...
Because I don't do that
when
anymore.
you shouldn't have been driving.
I don't do that.
Because if you shouldn't be driving, then 9 times out of 10, I'm the one who drove us.
You're right. But we've never had where I've been drunk or anything.
No, not even on a vacation.
No.
You don't drink Get rid of the studio audience, please.
But what I was gonna say is, unlike Kim, I was raised in a Caribbean household, and so they try to give you alcohol when you're 5.
No.
Excuse me?
My grandfather, my Aunt Lisa's dad, I've sipped on a champagne sitting on his lap.
Okay, well, I'm just saying.
I was like, I was like 4 or 5.
Yeah, they'd be like, "Oh, you're teething? Let's give you some rum," and then wonder why you were alcoholic 20 years later.
Okay.
I'm just saying.
Well, you don't call yourself an alcoholic, do you?
No.
A recovering one?
No.
Oh, okay. All right, I'm just checking, sis. Okay, so what I have here from the cancer.gov website is, it says, even though we're doing alcohol abuse, I got this definition for alcohol and substance abuse, and we're going to roll with it. Okay, so here we go. It says that it's the use of illegal drugs or the use of prescription or over-the-counter drugs or alcohol for purposes other than those for which they aren't meant to be used or in excessive amounts. So let me ask you something. If we take Benadryl because we want to sleep good at night, is that substance abuse?
Gets to a point where it could be.
Then you and I have both been on drugs. We have both been on drugs.
This episode is not about us.
I think that we have both gotten to the point where it did fall into this category. But that's the old us. We are recovering addicts, I guess.
Speak for yourself, girl.
Oh, are you still on? No.
I don't really take. Not really.
No, right? Yeah. Okay.
Only because of the whole dementia thing has kind of scared me, right? With this is just a sidebar, real quick. So, in case you guys don't know, if you take Benadryl regularly, it's been shown to cause dementia later on in life.
Yeah.
That also goes for benzos as well. So, Xanax or anything like that.
Take it in moderation, people.
Yeah. And
take it for a good reason. Take it for what it's used for.
Yeah.
Not for what you need it to be for. Okay. So that's my definition from the cancer.gov site. I'm not sure why that was on the cancer.gov. Well, it was probably on that website because I don't know if you guys know this, but alcohol is a carcinogen, which means it's toxic and it can lead to cancer. It can be cancer causing. Alcohol is a carcinogen. Listen to me, people. It's something that we should not be drinking. We should not be putting it into our bodies. But I guess it makes people feel good and it tastes good. I don't even think it tastes good. I've actually tasted a couple of things before, like just a little sip with my lips real tight. It don't even taste good.
Well, what did you sip?
I don't know. Right. I mean, a mimosa does taste good. I've sipped that before. But it's a carcinogen and it can lead to cancer. So just keep that in mind.
Yeah, it's literally poison. But you just take enough, so don't kill you. So some other statistics is that 28.9 million people, this is in 2023, have alcohol use disorder.
What is alcohol use disorder?
So that
Isabella?
is, you said Isabella? That is when you basically are an alcoholic and you can't control how much you drink, when you drink. Like you have to have a drink.
To have it. Like
you have to have a drink.
Oh my God.
Yeah. So that is a lot of people.
How many?
28.9 million.
That's in the U.S. or in the world?
That's the U.S.
Oh my God. That is a lot of folks.
Yeah.
And they just walking in the streets.
Yeah.
Because not everybody goes to like a bar to get drunk. A lot of people do it in the privacy of their own homes.
Mm-hmm.
Wow. So, do you know that 5 major complications that alcohol can lead to? One is liver disease, because the heavy drinking can cause your liver to like become fat. So you'll have like a fatty liver, right? Which can lead to liver disease.
Cirrhosis.
So that's also known as hepatic stenosis.
Mm-hmm.
Hepatic stenosis. You had the osis, right, girl?
Oh, okay.
Mm-hmm. And then it can also cause inflammation in the liver, which is also known as alcoholic hepatitis.
Ooh.
Right. Alcoholic hepatitis. So that's one thing. It can cause digestive problems, right? So like, I know some people who, if they drink alcohol too much, they'll have diarrhea, or they'll wake up vomiting the next morning. That's what they call a hangover, right?
Mm-hmm. Mm-hmm.
Yeah. It can lead to heart problems, right? It can also lead to issues with sexual function, and it can lead to issues of your period, right? So, I guess, when
with
it comes,
your period.
Yeah.
What happens with that?
I don't know. It didn't elaborate. So I guess when it comes to sex, excuse me, either alcohol can make you do the damn thing, or it can make you not do the damn thing. So you can have sexual issues. And then another one is birth defects, right? So I guess if you're pregnant, you really shouldn't be drinking alcohol. You really, really shouldn't. I used to take the express bus from Far Rockaway with this guy.
Was it the J bus?
No.
Oh, okay.
From Far Rockaway to the city with this guy whose mom drank and smoked while she was pregnant with him. And
he looked like
his third finger was connected to his thumb. Like his middle finger was connected to his thumb, and his pointer finger didn't exist.
Dang.
Yeah, and he told us that that's why, because his mom drank and smoked when she was pregnant with him.
Yikes.
Yeah, so ladies, if you are, now a lot of ladies I know end up drinking because they don't even know that they're pregnant. But once you find out that you're pregnant, please don't.
Your child might be permanently throwing up gang signs. That's what it sounds like.
Yeah. Yeah.
Because why?
Exactly.
That ain't right. She didn't have to do that to that boy.
Yeah, but don't forget, some women are pregnant, some women are left alone, and they get depressed and stuff. Just, I was going to say, just get rid of the baby. I probably shouldn't say that on here. But I don't know, Ernestine.
I mean, I don't know either.
What else you got over there?
Some other things that alcoholism can lead to, which I don't think a lot of people talk about, are domestic violence, right? So a lot of times they're saying 55% of people that commit domestic abuse were drinking. So that is more than half. And yeah, because once you start drinking and you don't really know what you're doing,
and drinking can cause like aggression, right?
I feel like, yeah, because I feel like people turn into different people when they drink. So there's some people that drink and they get like happy and they get goofy and they start doing things. There's some people that drink and they get angry. There's some people that drink and they get sad and depressed.
Is it true that when you drink, the truth comes out? Or is that just a saying?
I think it does. I feel like with me though, like I'm still not gonna say anything.
You gonna take stuff to your grave. You could be like, I'm drunk, I'm twisted, but
the
it's
drunk
my secret.
me still knows.
Okay. So I guess that would be that saying you handle your liquor just fine.
Yes.
Okay. So it depends on the person.
Yeah, it depends on the person. I feel like it also depends on the alcohol that they're drinking. So sometimes people act differently if they're drinking clear alcohol versus brown.
Brown is the devil, right?
Brown is the devil. I don't drink brown liquor because I don't I can't.
Okay.
I don't like who I am. That person might tell the things. So I don't do it.
Okay. Is tequila only clear?
Yes.
Okay.
Oh no, they have darker ones, but I don't like those.
Okay. All right. You educated me because, like I said, I don't drink.
So yeah, it causes them to commit domestic violence, and that could be obviously against their partner, or kids, animals, whatever. I know a lot of people talk about the car crashes that happen, right? So like drunk driving, personal injuries occur, people setting things on fire, cutting limbs off, and
cutting limbs off.
I mean, let's just say you're like drunk, you're like, let me make some, I don't know.
Oh, let me chop an onion.
Yeah, let me make hibachi or something, and then you get in there and you starting fires and you chopping fingers off.
Eat chopping broccoli. Chopping broccoli.
And this also can lead to risky behavior, right? So like if you are drinking, you're intoxicated, you lose control of like your decision making and your judgment.
Sex.
Yes.
Stealing out somebody's pocketbook, taking a debit card,
right.
Just poor decision making, impulsive decision making.
Yeah, because your inhibitions are down, and now you're just doing whatever. Like, I'm not even gonna say you're doing what you would really want to do, because sometimes it's that, but other times it's just like you don't even care, so you're just doing whatever. And then the other thing that I found when I was doing my little research was like about post-COVID and drinking, and how that kind of skyrocketed everybody drinking.
You think it's like depression and losing loved ones and stuff?
So I think it's a combination of depression, because again, our little temporary producers back there telling me to say that alcohol is a depressant, which it is. So mention that, but
it absolutely is.
It is. So I think it's a combination of, when everybody was like locked in the house, right? So like they were like, you can't go anywhere. You couldn't even go out to the liquor store. I think, were they delivering?
Yes, they were. I know some people who were getting deliveries.
And that's when all the restaurants started to like be able to give you your stuff to go too. Mixing drinks.
Yeah, because Chili's was doing that. Remember?
Yes. Yes, I do.
Yeah.
So I think post-COVID with like the, obviously people dying, that was sad. So people would drink because of that.
Yeah, because it felt good, because reality hurt.
It does. But also like you were bored. Like, I mean, personally, I was not bored because not only were we doing school for kids, but that alone.
We had Camp COVID going
on.
We
had camp, your house. We had camp at my house some days. We had to go to the hospital. Shit, that alone,
we were working.
Made me feel like I needed to drink anyway.
I was in grad school. It was a lot.
It was a lot. So like, people were losing their jobs.
Yeah. So one of the questions that I found when I was researching is, what does alcohol lead to? So it can dehydrate you. We all know that. So like I always hear people say, try to drink water, and especially if they drink too much, they're like, here, drink this water.
That was one of my mistakes, by the way, during the amaretto of
You didn't drink water?
2000 and whatever. I didn't drink the water in between. I didn't drink it before.
You threw up a lot?
Yeah, it was bad. And by the time it was too late, because you can't like try to make up for it.
I would have never drank again, child. They would have taken my limbs before I put more alcohol in my lips.
You and everybody know that it's a very bad alcohol experience.
Mm-hmm.
It's not really, that's not good.
We 100% real on this show. I've talked about my pap smears, my colonoscopies, my lumps in my breast, everything.
Yeah.
Tune in.
Man.
Tune in, Miles. No, it sounds like she's a recovering addict.
Yeah, I never did that again.
So one of the things is it can lead to dehydration. It can lead to exhaustion. So I guess that's why people be passing out. I don't know. It can lead to increased risk for chronic liver disease.
Oh, okay.
Cancer and viral hepatitis.
Oh.
Yeah. So those are some of the good things that it can lead to.
That's why a lot of people get those like IV drips after.
Oh, do they?
Yep. With vitamins, like a banana bag type thing.
I never knew that.
It helps.
Hmm.
Because it's mainly dehydration.
You know where I also see them getting hydrated at? In the ER.
Yes. That too.
So some symptoms of an alcoholic is increased tolerance, right? So like there's a lot of alcoholics who can take a lot. And you feel like they need octane to get them drunk.
Wait, let's go back because I need to understand. So, okay. So let me just, before she gets into that, define how many drinks per day
makes you an alcoholic.
Yes.
Okay.
So for a woman, well, actually, this is like the definition of binge drinking. For a woman, it's 4 or more drinks within 2 hours, and for a man, it's 5 or more drinks within 2 hours.
Really?
Yes. And then for a man, it's 8 or more drinks. 8 or more drinks per week for a woman, and 15 or more for a man.
Yeah, that sounds like a lot.
So if you are having all them drinks, according to the CDC, you're an alcoholic.
That's a lot of drinks, though.
That is.
Yeah, but then there's different types of alcohol. Some people want to drink extra drinks for a year.
You want to pull up a seat and be a guest on the episode?
Because when they do start drinking, they can't stop. There's some people that need to drink every day. There's some people that don't need to drink every day. You got to binge drink alcohol.
Mm-hmm. So I do have the 3 types of alcoholics here: essential, reactive, and symptomatic.
What's the essential one?
Hold on a second.
All right, while she looks that up, I'm going to finish saying what I'm saying. Symptoms of an alcoholic: increased tolerance, loss of control, neglecting responsibilities, ignoring negative consequences, and experiencing withdrawal symptoms. So those are all symptoms of an alcoholic, which I'm sure we both have identified that in folks before. My stepdad started drinking like the last 5 years of his relationship with my mom.
And what did you notice about that?
Increased tolerance, neglecting responsibilities, ignoring negative consequences, and withdrawal symptoms. I remember there were times when he was like slurring. Yeah.
From being drunk or from
drinking way too much. And that's when like a lot of their problems started.
Okay. I can't really find that in right now.
Okay.
And actually, I'm finding things there are 6 types and all these different types, but
Okay.
So we ain't gonna get into that. But they're saying the number one cause of alcohol abuse are social and environmental factors such as peer pressure, poverty, and sometimes physical or sexual abuse had occurred. And so that increases your odds of developing alcohol dependence. I mean, essentially, a lot of times people drink because
it hurts.
They are trying to escape their real life.
Something is hurting them, whether it's emotionally or physical,
Mm-hmm.
and they want to feel numb.
Yeah.
And it feels good, I'm sure, to be that numb. And then when it wears off, you need it again to feel numb again.
Yeah.
That's awful. That really is sad. So it sounds like people who have alcoholism issues, sounds like they need to possibly go to therapy.
Absolutely.
And figure out what is the root cause analysis. Pretty much.
Root cause analysis?
Yeah. Find out what is the foundational issue as to why you're drinking. Because there's one thing to drink sociably or to drink occasionally.
Mm-hmm.
But if you have to drink constantly.
Yeah, if you're having that 15 plus, that is your,
even if they have
that's
13,
your baseline. Yeah.
Even if they having 13 or 12, something is not right.
Yeah, because then it's going to get to a point where your body is relying on it, the substance. And then you're going to have to detox from that because your body is not going to be able to function without it.
Yeah.
So if you got to that point, you definitely need to seek some type of help to quit. And there are like medicines that you can take, like pills you can take to help wean yourself off of drinking alcohol. But I guess we'll talk about that at the end.
Do you know anybody who's ever done AA?
Yeah.
Was it successful?
So I'm not gonna say who it was.
Of course not.
Right. But they'll probably just tell you anyway. He had to go like, damn, I wish I remember the number. Probably 30 times before it worked.
Was it like twice a week?
No, I mean like starting and stopping it.
Oh my God! Like re-enrolling?
Yeah. Yeah.
Oh wow. That's a lot.
Could be more than that. I could be understating that number.
That's a lot of failure before they were successful.
Yeah.
So they were successful eventually?
Yeah. They are. Yeah.
Maybe it sounds like the person wasn't ready.
No.
That's what it sounds like. Do you think that they hit rock bottom?
Yeah.
When they first started? Like they were already at rock bottom?
Probably not. That's probably why they had to keep going back.
Wow. I didn't, I don't know anybody that went. I might know the person, but I didn't know that they went. You know what I'm saying?
Mm-hmm.
Yeah. I only like seen it on TV. And I've recommended it to patients, but wow. Well, that's good to know that it works because they have like support groups and stuff there, right?
Yeah, you can go and follow those steps, like 12 steps.
A lot of times though, people have to like hit rock bottom and like lose their loved ones, lose things before they're like, all right, I have a problem and I've lost everything. I have nothing left. Let me do this.
Yeah, I feel like everybody's rock bottom is different though.
Absolutely.
So some people might, I don't know, you think like, oh, if you have kids, you look at your kids and they're suffering, or you've abused your kids, or if you've killed someone, or if you've, hurt yourself or someone, then that's your rock bottom. But that's not always the case.
Because some people might be like, fuck them kids. I prefer this bottle right here.
Exactly.
I ain't want them kids anyway.
Right.
Wow, that's sad, but it's also good to know that programs like that actually do work. And then they have types of rehabs where you can like go away and stay places.
Mm-hmm.
Those probably work too, because then you actually detox. I've had patients before who have come in through the ER and they ended up on our med surg unit and they detoxed on our unit. It's awful to watch.
Yeah.
It's awful to watch with the screaming, the crying, the cursing, the violence, the feeling like they are useless. It's just like some of them had to be put into restraints, the scratching, the itching, it was just awful, like awful to watch. And you watch them over multiple days go through this detox period.
Can't they just put them in like a medically induced coma real quick to get them through it and then bring them back to life when, you know what I mean? Like in a week or two?
I mean,
no.
The only time they probably do that is if the patient comes in
and they're already about to be in a coma, and they're about to,
like, they come in and something medically is wrong with them. Like, let's say they had a bad car accident because they were drinking really bad and they needed to be put in a coma. Then then I guess lucky them that they'll be put in a coma. But it's awful to watch. Okay, so there's this thing called alcoholic face. Have you ever heard of that?
No. I'm sorry, I don't mean to laugh, but that sounds. Just describe this because I don't.
Yeah, it's alcoholic face. So a lot of times you can tell an alcoholic, their face is puffy because the excessive drinking causes the body to retain water. So they have like this puffy look to their faces, and they have dark circles up under the eyes.
Okay.
And they have broken blood vessels in their face, which is also known as spider veins. Okay. They have them. I don't think I've ever seen anybody with spider veins in the face. You?
I mean, can we see this in
besides
people
Freddie?
Like that?
Besides Freddie Krueger? So they have spider veins, and then they have eye discoloration, which I'm thinking because the liver is involved, is closer to a jaundice type of situation. That's what I'm assuming. And the face can be red.
So what about black people? Because all the things you just said, I mean, minus the eyes and the puffiness.
I guess if you light skin, you can still see all of this. But if they're of a darker complexion, I don't know. I guess we just looking for the fat face. We'd be like, James, your face getting fat over there. You been drinking?
I feel like it's more than fat, though. I feel like it's just like a look. And I know what you're talking about.
Let me Google it. See if I can find a picture of the alcoholic face.
So basically, you looking like a puffy, jaundiced.
Oh, look.
Spider veiny.
Before and after. Person. Look how puffy his face is, and hers too.
They just look like they lost weight. They look like different people. Again, all white people. Nothing against y'all, white people that are watching this.
Look at the dark circles up under his eyes here. Oh, he looked like that's his mugshot.
He looked like he was doing
a different person.
He looked like he was doing more than just having a little drink. He was
substance abuse too.
Yeah, he was doing something else.
She has a fat face originally, but look,
not originally.
Wow,
that one don't really look much different. I gotta say.
He Hashi Tashi 5,000
looks like an after and a before.
He's Hashi Tashi 5,000, so he don't count.
I can't, and I'm not doing this with you.
Look.
Oh.
He look cray cray.
Yeah, he does.
Oh, here's a black person.
That looks more like a... Oh, okay.
She just came home from jail.
She's doing more than drinking. Anyway, y'all can't see this, but...
Yeah, because I don't want to show their faces on here. And then somebody sue us a little bit later.
That's on Google for everyone to see.
True.
So,
it is. Yeah. It is.
Yeah, we just pointed that.
So that's an alcoholic face. Now I'm going to have my eye out next time I go to a lounge or something and see who look like they got a drinking problem.
Can you be going to lounges?
I don't know.
You don't be going to lounges?
I really don't. But if I end up in one.
All right, well, take me with you.
When I go to Costa Rica, you might go to a lounge.
Oh, okay.
How you doing? And then, have you ever heard of alcoholic gastritis?
Is that just the hangover or is that something different?
You get that bloated or full feeling in the abdomen. You can have pain that goes from dull to like a sharp stabbing pain.
Okay.
Which is like in the upper abdomen, and nausea and vomiting.
Ooh.
So it's gastritis symptoms, but...
And how long does that last?
Till you get better.
Okay. All right. So did you talk about cirrhosis? You talked about like the
Nope.
hepatic liver.
Hepatic liver.
But the cirrhosis is something is that just like the hardening of the liver? Like it starts to form these hard spots on your liver until it's non-functional and you either need a transplant. Well, you're going to need a transplant because you cannot live without a liver.
Yeah.
But can't the liver like regenerate?
It can, but that I believe that damage that is done to it when it comes to the alcoholism, that's not an option for that one.
So you can't like cut off the cirrhosed parts, and
I'm assuming the whole liver is cirrhosed.
Dang. I mean, you guys can Google pictures of what that looks like. It's not pretty. It does not look good.
And the patient doesn't look well. They look dark and they look pregnant in their upper abdomen.
Is that called ascites?
So yes.
Look at me.
Look at you. That's because we went to nursing school together, girl.
Right?
Yes, that is called ascites.
Okay.
And it doesn't matter how many times they pull that fluid off. It's gonna come back.
It's gonna come back because it's building up. Because your liver is responsible for clearing out all the toxins in your body. So if that is not functioning properly, it's going to manifest itself in several different ways. So the jaundice, as well as the because that's when the bile builds up, right? I know a little something.
She went to nursing school with me, guys. She didn't know she was there, but she was there.
Yeah. So the bile builds up, so that's what creates the yellowing of the eyes.
And the skin sometimes, too.
Okay. And
which is also known as?
Jaundice.
Yes. She's so smart, y'all. She ready for her class.
But can't they just put you under some little rotisserie chicken lights like they did for the baby?
For the baby?
Because I remember when Omar had a little bit of jaundice when he was born.
Me too.
You did? And they were like, they had to put him under the lights, and they kept checking the bilirubin.
And then did they tell you to like
put him in sunlight?
Yeah.
So then I had to put him in the sunlight at a window with his little stove and cook him like a little rotisserie chicken.
So the only difference is me and Omar as babies didn't have the toxicity of the liver like these folks do. So I don't think that the rotisserie chicken light is going to work for Uncle Bubba and them. Okay.
Yeah, they probably just need a new liver altogether. And if they don't get that, then
I'm sure it's way too late at that point. You see it in like a lot of older people.
I've heard, and I've just come across like TikToks and posts and things like that is an awful way to die. Cirrhosis of the liver. I've heard that it's extremely painful. There's a lot of suffering that's involved with the person. It's just not a good way to watch your family member pass away, and it's also not a good feeling for them. And I also think it's just not a good feeling to know that they pretty much have caused it. I understand that once it gets past a certain point, you're addicted, and it's like really hard to break that unless the person went over 30 times to.
One of my uncles died from cirrhosis of the liver, and he just got so sickly looking. He was dark, his stomach. When I tell you guys, it looked like he was about 8 months pregnant. He looked like he was about 8 months pregnant, and he just got weak, really like weak. And it wasn't like a long period of time, but it also wasn't super fast either. Like he suffered.
Damn.
He did.
And I feel like drinking will impact different people in different ways. So there might be someone who does have 15 drinks a week and they never get cirrhosis of the liver. They're fine.
Yeah.
But then there's others who, just drink maybe moderately to a little bit on the heavy side for a little bit and they have it.
But because the 3 people I've ever seen in my life with it. Because they're older, they were like over 65, like between 60 and 65. I just wonder if when you're younger and you are drinking, if it is gonna really automatically catch up with you in one way or another.
I think
you
it
can
does.
run, but you can't hide.
I think it does. I also think that your overall health, consider that. They do say that it is, when I was doing a little research, I came across it. One of the questions was, is it better to be a binge drinker, which is someone who has like a lot of drinks within a few hours, versus someone who drinks every day, has like 1 or 2 drinks every day. And the person that has the 1 or 2 drinks every day is probably worse off than the person that will drink like 4 or 5 drinks within 2 hours, once a month.
Really?
Yeah. Because they're saying that it's the consistency of the everyday stuff that's not
so
good.
It's kind of like after you recover a little bit, then cram, it's right back in your system.
Yeah, because you're putting it in there every day. It's like a constant flow of alcohol.
Toxins.
Yeah. It really is poison.
I will tell you, when I'm on vacation, I get my virgin pina coladas. They're really good.
I will tell you that, yeah, it's just not the same, girl. I'm just gonna tell you.
It's really good.
For me, I drink maybe on the weekends or something like that, but
it's not every weekend.
And it's not.
It depends on the company you keep.
It does. But also it depends on how I feel. If I don't feel like drinking, I don't drink. Like, that's how I know I don't really like have a problem with it, because I don't feel compelled to have a drink.
You do not have a problem with it.
But sometimes I feel like, oh, I just want like a pina colada, or I want some wine or something like that. And it does have a relaxing effect, at least for me, right? So I'm a naturally like wound up person. Like, I'm just wound up, and it helps relax me a bit. So I do like it for that.
Okay.
But like we said earlier, if you are having issues, you should definitely seek out help to quit, because it isn't good. And if you are already to a point where you have alcohol use disorder, there is no such thing as, oh, I'll just have a drink here and there. You probably should stop drinking altogether, because you don't have the discipline to cut yourself off or to limit how much you're drinking. You don't. And so it's best to help your overall health to stop. So you should just stop drinking. If you can't, you have to evaluate. Kim just said it's the company you keep. So if all your friends, if that's all they do, you have to get new friends. I'm sorry, but you do.
Yeah, definitely. And if you guys want to call an alcohol abuse helpline, the phone number is 844-714-7186. It's an alcohol abuse helpline. You don't have to tell us. We don't have to know. You can just call, whether it's for you or for somebody in your family, somebody close to you. You can call and they can assist you.
Yeah, because I think that's the other thing that a lot of people don't talk about, are the support people around the people that have alcoholism, right? So whether that's a spouse, a sibling, a parent, a child, all these people are impacted by their decision to consume alcohol and their dependence on it. And so we have to deal with, when I say we, I just mean, I mean we, because quite honestly, we have to deal with whatever is happening with that person once they start drinking. And that could be anything, to be quite honest. That could be them saying hurtful things. That could be them doing hurtful things. That could be them hurting themselves or others around them.
Could be them being sick, having to be rushed to the hospital.
Yep. And so that's a lot. That's almost caregiver status, but like on another level, because
it affects the people that are around you.
Yeah.
So, in other words, that's some selfish shit.
Yeah.
Sorry to curse, but
It is.
it's selfish because it doesn't just affect them; it affects the people that care about them as well.
Yeah. So
But if they don't care about themselves, why they gonna care about us?
exactly, they can't possibly care about you.
Yeah, that's very sad. It is. You got anything else?
I don't know. That was kind of sad. Like,
It's sad, but it's the truth.
it is. I mean, I don't know because I have a sordid opinion on alcohol, and that's really because it can be very fun, but there's a point where it turns into like not being fun and just being dangerous. So
that sounds like unprotected sex. It could be fun, but then it could turn dangerous.
Yeah.
So the person has to know where enough is enough at.
Yeah, and unfortunately, most of the time, once you start drinking, they lose sight of that because once you've had, let's just say, I don't know, 3 drinks, depending on the person, that might be where the guardrails like fly off,
Child,
and they just don't know. So know your limits. But also, if you have an issue, call that number.
Yeah, call that number if you have an issue. If you know somebody who has an issue, just reach out for help. All right, I don't have anything else with this topic.
Me neither.
All right, I just want to say 2 things.
What?
Y'all know I'm always putting my business out here, so here I go. Next week I'm going for my MRI, mammogram, and ultrasound of the breast all in the same day.
Okay.
I'm gonna need for y'all to pray for me, please.
What day?
October 9th.
Okay.
Okay. This is what the radiologist recommended because from her words, you got a whole bunch of stuff going on and you just want to make sure it's okay.
Oh, I didn't like that.
Yeah,
lady.
I didn't like her either.
Okay.
So I need for y'all to pray for me, but by the time y'all watch this, October 9th will be long gone. So
yeah.
And then I said I had 2 things. What was the other thing I had?
Was it about dementia?
No, because that's what is actively happening right now is dementia. I don't know what the other thing was. For all of you who are over 50, get your pneumonia vaccine because I just had pneumonia in my right lung. I'm still recovering, actually. So
and the vaccine would have prevented that?
Maybe.
Okay. That's the Prevnar, whatever, 67,
pneumococcal thing,
82 max that they got going on. I don't know what numbers they have behind it nowadays. So
yes, that is the vaccine.
Okay.
So if you qualify for the pneumonia vaccine, get it. I don't know how I caught this. The doctor said it was community acquired. So
community? Oh God, well, girl, you ain't tell me that. I would have worn my mask during this episode.
No, I'm fine now.
Are we sure?
The antibiotics almost killed me. I'm not going to tell y'all the symptoms that it caused, the side effects, that it caused, because that's a little too invasive. But just know that the side effects were worse than the actual pneumonia.
Damn.
Well, no, because I was coughing up a lung. That hurt. Yeah. That hurt real bad. It hurt my lungs in the back. It hurt my lungs in the front. It was awful.
Lungs in the front?
Anterior, posterior lungs.
Oh, okay.
Anterior, posterior.
I was sick on that day at the nursing school.
I can't. So yeah, so just protect yourself at all costs. And if you're of age, get the shingles vaccine as well. Well, I'm just throwing out these vaccines.
Can we get that? Because I'm not trying to get shingles because
they normally don't want to give it to you until you're 50.
Well, look, because shingles, what's on commercials? Shingles don't care.
It doesn't.
That's what they said in them commercials. They said, "Oh, you got a trip? You going to Costa Rica?"
Yeah.
Shingles don't care.
Yeah, shingles don't
Shingles
care.
wants to go to Costa Rica too.
Yeah, shingles really doesn't care. I have a question for you before we log off.
Okay.
When I look here, is my face in the screen? Because this whole time I've been looking here. So I just want to know if I've been looking cockeyed, like what's going on.
Oh man, you know what? I didn't really realize it, but
you making this about you. I'm asking you when I look here, do you see my eyes down there? No! Oh my God, where are my eyes? Where are my eyes, Jasmine?
Look at the computer. I don't know, Kim. I don't know.
Where were my eyes?
I don't know.
Where were my eyes when I'm looking here? Where are my eyes? Take a picture since you can't tell me where my eyes are. This is so crazy. Take a picture, please, so I can see where my eyes are. Sorry, guys. You are part of this because I need you guys to know that I'm
Where
not.
are you looking? Okay.
I need you guys to know that I'm not cockeyed. We got a new camera. And Jasmine didn't tell me where to look.
I just realized that I don't know either.
I don't know where I was looking.
I don't know either. So,
all right.
Pardon where we're looking.
Pardon where we're looking.
If it looks crazy, it's because, look, we had all types of new stuff going on here today. We have two different ring lights. We had a pseudo executive producer, which you will hear in the background because
nobody hired him.
Nobody said. We might not be able to edit all that out, and we don't know where we're looking apparently. So it's a whole well lit. Clearly, I'm shining in some places. I try to get rid of that. Men in the background and cockeyedness. So,
and a dog eating his dinner in the background. So
yeah,
but the information is solid.
Yeah,
I don't know where to look. I guess we'll figure it out by the next episode.
Okay.
All right. Well, Jamie, don't get rid of any of this because they need to know that we're not cockeyed and that we weren't wandering somewhere. That this is just what ended up happening. So we will figure it out by next episode. Thank you guys so much for tuning in.
Thank you.
Tune in next time for more Snitches.
Yes. Bye, guys.